Hi, I'm Lauren Nichols. This brief video is going to discuss borderline personality disorder, symptoms and treatment, and how it frequently co-occurs with other addictive disorders, including process disorders. Empirical research shows that addictive disorders and other mental health disorders are highly correlated. In other words, co-occurring disorders are very likely when you are working with a client with substance abuse issues. A study that our book references from Ross, Glasser, and Germanson reports that out of 500 drug-abusing patients, 73% had a current personality disorder. This is the category that borderline personality disorder falls in. Since co-occurring disorders are likely, it is important for the counselor to be competent in treating both aspects of the problem, both the substance disorder and the mental illness, in order to truly help the client recover and work towards holistic wellness. As our studies show, in both our readings and our videos that we've watched, it can be difficult to determine which is the primary disorder. Oftentimes, it can be the one that occurs the first or the one that has been around the longest in the individual's life. Regardless of the primary issue, it is critical that the therapist be able to competently help the client address both issues to work towards recovery. SAMHSA, which stands for Substance Abuse and Mental Health Services Administration, did a national survey on drug use and health in 2002, and it found that 17.5 million adults aged 18 or older, which was 8%, were estimated to have a serious mental illness in the past year. About 4 million of the adults with a serious mental illness in 2002 were also noted to be dependent on or abused alcohol or an illicit drug. That is, they had a co-occurring substance abuse and mental disorder. Among adults with co-occurring disorders, 34% received mental health treatment, only 2% received specialty substance use treatment only, and 12% received both mental health and specialty substance use treatment during the past year. This means many individuals are not getting the treatment that they need. And moreover, if they have a co-occurring disorder, both needs are not usually being met through mental health services. Now I'm going to specifically talk about borderline personality disorder, which tends to have a high comorbidity with substance use disorders and other process disorders. In order for addictions counselors to be more aware of borderline personality disorder, I will first go through the DSM-5 characteristics. Then I will talk about how substance use disorders more specifically manifests in borderline personality disorder. And then I will close by doing a brief overview of DBT, or dialectical behavior therapy, one of the best ways to treat individuals with borderline personality disorder. The DSM-5 describes borderline personality disorder as a pervasive pattern of instability of interpersonal relationships, self-image, and affects, and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following criteria listed on the screen. Number 1, frantic efforts to avoid real or imagined abandonment. Number 2, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and evaluation. Number 3, identity disturbance. Number 4, impulsivity in at least 2 areas that are potentially self-damaging. And as you can see, listed on the screen are a lot of the substance abuse disorders or process disorders that we've talked about in class, which I will return to in the next slide. Number 5 is recurrent suicidal behavior, gestures, threats, or self-mutilating behavior. Number 6 is affective instability due to a marked reactivity of mood. Number 7, chronic feelings of emptiness. Number 8, inappropriate, intense anger or difficulty controlling anger. And 9, transient stress-related paranoid ideation or severe dissociative symptoms. The DSM-5 says that the median population prevalence of borderline personality disorder is 1.6%, but may be as high as 5.9%. Females are primarily diagnosed with this disorder, as 75% of those diagnosed are females. As I stated on the earlier slide, one of the diagnostic characteristics for borderline personality disorder is impulsivity in at least 2 areas that are potentially self-damaging. And the examples we see listed are process disorders and substance use disorders that we talked about in the semester, such as spending, substance abuse, sex, reckless driving, and binge eating. Within borderline personality disorder, substance use and process disorders often are an attempt to alleviate emotions that individuals perceive as unmanageable or overwhelmingly negative. They try to replace them with pleasant feelings of intoxication or disassociation. It could be, too, that the process or substance use disorders are triggered by social environment. If people with borderline personality disorder are highly concerned about not losing relationships, it's possible that peer pressure and environment can have a strong impact on their behavior. A medical study found that approximately 78% of those diagnosed with borderline personality disorder also develop an addiction or substance use disorder. Those with borderline personality disorder and an addiction disorder demonstrate an increase of suicidal behavior and are less likely to be successful in treatment. At this point in time, one of the best treatment options is dialectical behavior therapy. Dialectical behavior therapy was developed by Marcia Linehan, and it uses individual therapy, skills training, and consultation, both as needed, and therapist consultation meetings. There are 3 primary theories behind this: behavioral therapy, to increase adaptive behaviors; dialectical philosophy, or holding 2 oppositional views as both being true, such as it's possible to both wish to be sober and to want to use substances; and biosocial theory, or emotional regulation. There are 4 domains that it focuses on: the biological, environmental, spiritual, and behavioral. The main goals of dialectical behavior therapy are to increase the client's motivation to change behavior, to promote and strengthen the client's abilities, and to focus on the client's environment and to make it more conducive to change and to generalize the client's behavioral changes to their environment. If you're interested in dialectical behavior therapy, I encourage you to check it out and to read more about it. I hope that this brief video has been helpful and that now you will be aware of borderline personality disorder symptomology and how addictive disorders can co-occur with this specific personality disorder. Here are the sources I relied on for this video. Thank you so much for listening.